All right, welcome everyone to Empower You. Thank you guys for being here. Thank you guys for joining us on Facebook and Instagram. We appreciate it. Empower You is something that we put together a couple of months ago up in the Tri-Cities, and we decided to bring it to Knoxville after a lot of conversations, and it went over so well in Tri-Cities. We're super pumped about it. But first, before we get going, I want to thank our media team, Mom, Jenny, Olivia back there. We got Katie behind the phones there. Thank you guys for being here. We're going to have a great discussion today. We're going to have a panel of experts coming up with health coach Sherry Fetzer, Dr. Tom Rogers, who's the founder of Performance Medicine and our medical director. And with the keynote speech, we're going to have Cara Cairnes, our nurse practitioner in the Knoxville office, talk about hormones, weight loss, nutrition, and some medical aesthetics. We're going to have Jasmine Allmon come up in the panel as well and talk about aesthetics and why that's important to your optimal health. So anyways, thanks for being here. I'm Ben Rogers. I run these clinics with my dad, Tom. We really appreciate all you guys joining us, especially the guys here. So thank you. We're going to bring up Cara Cairnes, our nurse practitioner over at the Knoxville office. She works in here as well as Franklin.
Thank you. Hi everybody, we're glad you all joined us today. We've got some really good information for you. Today we'll be discussing these nutritional balance, weight management, hormone balance, medical aesthetics. And then our next meeting in April, we'll do exercise daily, sleep well, and stress management. We've got a great panel for any of your questions when I'm finished speaking. If you have any questions, you can always write them down on your card, and then we can answer them after. All right, so I'm just going to touch on nutrition and weight management and just briefly go through that. And then we have Dr. Rogers, Sherry Fetzer, and then Jasmine Allmon here to answer any questions. So the first subject is going to be you are what you eat. Carbohydrates are a chain of carbon, hydrogen, and oxygen. It's sugars. You'll hear good carbs and bad carbs. So the bad carbs being the high glycemic index, things like sugar and candy. But there's also good carbohydrates in what we eat, such as fruit, fiber, and vegetables. The second group is proteins. They're actually a chain of amino acid. They provide function, structure, regulation of body tissues. A lot of people think that they need a lot of protein. You'll hear a lot of hype about protein. But really, adult men only need about 56 grams a day, and women about 46 grams. These are good proteins from like fish, grass-fed beef, eggs, liver. And bad proteins are those with nitrite-containing products like hot dogs, other processed meat like bologna, and then soy. Lastly are fats, and fats have kind of gotten a bad rap. We've been taught we need low-fat diets, but actually they're very important. They provide energy and help us absorb fat-soluble vitamins like A, D, E, and K. So the bad fats come from cookies and ice cream and refined vegetable oils, but really what we're talking about is good fats. Come from avocados, coconut oil, nuts, and things like almond butter. At Performance Medicine, we have several different diets that we teach our patients about when they come in. They're having trouble losing weight, they put on some extra pounds, they've tried some other fad diets that haven't really worked out. And so basically in ketosis, you actually add more fat, believe it or not, which is good fats. So you might hear Dr. Rogers talk about bulletproof coffee and adding MCT, medium chain triglycerides, to his coffee, ghee, grass-fed butter, and adding this fat to a morning coffee actually helps suspend your appetite a lot more than the protein that you hear. And they're actually the ketones are actually a byproduct of fat, so your body learns to burn fat for energy instead of carbs. On a ketosis diet, it should be less than 20 grams of carbs. If you're wanting to follow a low-carb diet, it needs to be less than 50 grams. And what a lot of our patients do is they have an app on their phone, and so they just key in what they've been eating, and actually it has a special place for it for macros. So it tells you how many carbs you need, how many fats you need, and proteins, and so it gives you a goal, and it also measures what you're eating. So it's a good way to keep track of what you're eating and also whether or not you're meeting your goals. But anyway, Sherry Fetzer and Dr. Rogers will talk more about that. Intermittent fasting, this is also something that we teach our patients, which is getting all 3 of your meals within an 8-hour period. So if you eat dinner 6 o'clock at night, not eating anything until lunch the next day. So this actually has a lot of really good benefits. Decreases inflammation, heals your gut, helps you to lose weight, and this is also a way to help with promotion of gut health, reduce toxins, and also increase human growth hormone. Then we have the fasting mimicking diet. It's a 5-day fast. We have been using Prolon, which comes in a kit, and I brought one with me tonight if you're interested in looking at it. It has 5 days. Each box is numbered 1, 2, 3, 4, 5, and it has everything you need for that day. And it helps with stem cell rejuvenation, and also long term. If you do this, they have data 3 months doing a 5-day fast each month for 3 months in a row. It's shown to reduce glucose, cholesterol, as well as blood pressure. So they have some really good data on that, and you can buy that online. We sell it in the office, and we've had some very good success with that. And I brought some flyers too. The autoimmune diet, Dr. Gundry's food strategy is up here, and it also helps with inflammation, people that have autoimmune problems, arthritis, thyroid, weight gain. This also is very good. And then HCG is probably one of our most popular diets. It's a good way to kind of kickstart if you're having trouble losing weight. It resets the hypothalamus. It is a 500-calorie diet and use injection of HCG sub-Q for about 23 days, and then you just reduce your starches and sugars. So basically, your body is literally in ketosis, learns how to burn fat for energy instead of carbohydrates, and so you literally excrete the fat. So this has been very useful. Our patients lose about 20 pounds in the 23-day diet, and it's very structured. For people who like structure, you have a certain list that you buy your groceries. They have a meal, a sample of your menu for that day, and then it also has places to write your weight and what you had to eat that day, and is also another very good diet. So basically, it's just general guidelines. I'm sure you all have heard before. You want to limit your fast food, increase water, eat more vegetables, portion control, avoid what they say, anything white, pasta, sugar, flour, cookies, cakes, chips, and also avoid dairy. You'll hear coconut milk, almond milk as good replacements. Actually have more calcium than just regular milk. The regular milk actually has a lot of sugar in it. And then for any kind of artificial sweetener, we recommend stevia, and try to stay away from aspartame. And then in any kind of chocolate, we have chocolate lovers out there, try to keep it above 72% cocoa, so it's in a dark chocolate meal. And I find people are most successful if they plan and they meal prep, and then they're ready for their week. But our panel will speak more to that. Okay, now talking about hormones, which is really what we do well, we love to do. We see a lot of good benefits. Our patients come in, male and female, all different ages. They're complaining about hot flashes, mood swings, vaginal dryness, decreased libido, and just a myriad of things. We always think checking their hormone levels, especially if they've had a hysterectomy or if they're in a menopausal or menopausal, andropausal age. And hormones are actually signals, messengers to the brain that go to the organs. and they maintain balance. So it's really the temperature in the body, whether it's up or down, and it's a negative feedback system that raises temperature, raises hormones, and adjusts them accordingly. So here you can see the hypothalamus in the brain actually is sending messages to the thyroid, the adrenal cortex, and then the gonads, which where our sexual hormones are. The first one is testosterone. This is important both for men and women. They come in with the similar symptoms: fatigue, libido, lack of mental focus, and sometimes with the men it's lack of competitive drive, loss of muscle strength. They're really not getting as much as they once were out of their workouts. And as we age 40 to 50, then these start gradually declining, and then when they come to us, then we usually draw some labs and talk to them about their symptoms. I know when I call Dr. Rogers on the phone, and the first thing he says is, how are they clinically? So it's not all about labs, it's really about presenting with symptoms. We do have a range, and this is numbers that you may want to write down on your paper. We can talk about it later with Dr. Rogers in the panel. We do have a goal. For males it's 250 to 1,000, and for females it's 2 to 45. So you may have a range on the lower end of normal, but what we believe in is optimal health. So if you were maybe on the higher end of normal, how much better you would feel with supplementing. So here are some just some symptoms if your testosterone is too low, too high. For males, as I said earlier, andropause happens about 50 years old. And we talked about decrease of muscle mass, decreased libido, erectile dysfunction, mental fogginess, and you'll get some more belly fat. Females have similar symptoms, but they also have, as well as men, sleep disturbances, and getting your hormones back to optimal levels can certainly help with all of those symptoms. The second hormone is estrogen. This is very important for our bones, our heart, skin, and the females range is 15 to 350. And this is a little bit different with perimenopausal, postmenopausal women. We usually draw the labs 19 to 23 days after they have a period to see where their levels are if you're perimenopausal. Sometimes after hysterectomy or menopause, we still aim for a level of about 60. And in men, we don't want your estradiol to be too high or too low, so we want to keep it in a range of 10 to 40. So as we talked about before, estrogen too low, hot flashes, night sweats, mood swings for females, and for men, sexual dysfunction, and you can also get osteoporosis. Too high, you can have some breast tenderness in women, and in men you can have some mood disturbances. Oh, sorry, I hit the wrong button. Okay, and progesterone, it's a common belief that if you've had a hysterectomy, you don't have a uterus, that you don't need progesterone, but actually progesterone is very important for other things. It balances estrogen, it's good to rebuild bone, it's also good for mood and for sleep. So with men, it's very easy. It's just testosterone replacement therapy for a low testosterone level. But for women, it's a little bit more complicated when women come in and they're having some symptoms. It's really what we call a symphony. So you have to have a balance of estrogen, testosterone, progesterone, and they all have to be in balance. And if one of them is a little bit off, then you're kind of tilted and you're just not feeling optimal health. So it says here females, it depends on timing of menstruation, but for postmenopausal women, we like the range within 2 or 3. So progesterone does have a very important role. We can dose it in the cream, but sometimes we'll dose it at night before bed because it helps with sleep. And that tends to be one of the symptoms is insomnia when your hormones decline. So if it's too low, as I said, you have some anxiety, depression, some hot flashes. We also use it in hormone replacement therapy if there's some abnormal bleeding, and sometimes they use it after women have after childbirth. So the hormones greatly decline, and you experience postpartum depression, and so progesterone can really help those new moms. If it's too high, you can have weight gain and bloating. Okay, so we already talked about hysterectomy, which is called acquired menopause, and then perimenopausal, meaning your periods are kind of on and off, kind of spotty, and menopause is actually when you haven't had a period for at least 12 months. All right, and then next we'll talk about the thyroid. We have some really important levels at the bottom. Most of the time when you go to the doctor, they just measure the TSH level, and they say, oh, your TSH is fine. But when they come to our clinics, we also measure the free T3 and free T4, which are very important in regulating hormones and thyroid function. It controls metabolism, heart rate, digestion, things like that. So patients come in and they say, well, I've gained weight, I'm having trouble losing it, I'm tired, my hair is falling out, my skin is dry. So these are things that we like to check for a thyroid level, all 3 of those, when they have those types of symptoms when they come into the office. So I mentioned the too low, hypothyroidism, fatigue, mental fog, the cold intolerance, weight gain, brittle hair, nails, and then if it's too high, then you can have palpitations, tremors, and actually weight loss. So it is a delicate balance and a fine line between too low and too high. So we monitor those labs about every 6 months if you're on thyroid replacement therapy. And here's a picture again with the hypothalamus and how the brain sends out messages. Another very important hormone is cortisol, and cortisol is released in response to stress. It can raise your blood sugar, your blood pressure, heart rate, and you can have excess belly fat. So we can measure just a spot cortisol check in your labs, or we can do an actual test, salivary test. And Dr. Rogers can talk more about that and the cortisol level in response to stress. Because actually, if you're under stress for long periods of time, you can actually have low cortisol levels over time with adrenal fatigue. So here are some symptoms of too low and too high of cortisol. Performance medicine, we have several ways that we replace hormones. Patients come in, they're symptomatic, as I mentioned earlier, clinically presenting with symptoms of low hormones, or what we call suboptimal. So if we still remain in the safe range, we replace them to optimal levels, then it makes you feel a lot better. And we use bioidentical hormones. We use compounding pharmacies, not used from big pharma, which can, some of those come from like pregnant horse urine and things like that. So we want to try to use natural things and in functional medicine. So here again are some important numbers that we talked about the testosterone levels for men and women, estrogen, progesterone, thyroid level, and also cortisol level. We have different ways we treat hormones. Probably Dr. Rogers' favorite is pellets, and you get those, they're inserted under the skin, and it's a very quick procedure, painless. We numb the area, monitor your labs, and those are usually about every 4 to 6 months. For women, we can start off on a cream that has estrogen, testosterone in it, and we can add the progesterone to your cream or dose it by mouth before bed. And then we also can do thyroid replacement therapy. So these listed here, you're probably used to levothyroxine or Synthroid, which is only T4, but we try to stay with more natural things in functional medicine like Armour, Nature-Throid, which have T3 and T4. T3 is really the powerhouse. Then with cortisol, we talk about stress management and adrenal support. For severe cases, we can write certain medications like Cortep. Last is medical aesthetics. We do injections like with Botox and also with Juvederm, and we want you to feel better from the inside out. So as we get your hormones regulated, you get to feeling better, and then you think, well, you know, maybe I want to look better on the outside too. So this is your face as a journey, and how we gradually develop loss of collagen in our faces, and these fine lines and wrinkles that, and also well as age spots that develop over time. Botox primarily used in the forehead, sometimes around the eyes. We can do a little bit around the mouth, but the fillers are mainly to just fill in areas that have gotten to be kind of flat or saggy over time as you age, the marionette lines, and that is, it lasts, well, Botox a few months, and then maybe 18 months on the Juvederm. And we have Jasmine here that will fill us in on that on the panel. And here's a little information about Botox. It's FDA approved. It softens wrinkles and smooths fine lines. And basically, these are just non-surgical alternatives. Then the dermal fillers like Juvederm is to improve fine lines and wrinkles. We can also do the lips. I didn't mention earlier. And then if you're going to do all that, then of course you want to protect your investment, and you want to invest in some really good skincare. And Jasmine will also speak more to that, some things that we offer. We have a laser that does all of these things here: skin resurfacing, hair removal, define little veins on your legs that we have. We offer that in our Johnson City office, as well as oil therapy. You'll see here Christy Brinkley is a spokesperson for them, which actually using this oil therapy actually encourages your body's own natural production of collagen, and that takes about 3 months, but we see results in as little as 5-8 weeks. You can start to see fullness in the face, and actually that's your own collagen being stimulated. And as you can see here, we have our founder, Dr. Thomas Rogers, and you can see how he has notably improved before and after pictures. So he's had the laser and the oil therapy, and so you can see when you use them both together, you really have very good results. And as you notice here, right here, it kind of helps tighten this. You can also do it on your neck, décolleté. So anyway, both of those work well together. Okay, now that's all that I have. We'll turn it over to the panel, and if you have any questions, Dr. Tom Rogers, Sherry Fetzer, and Jasmine Allmon up here to answer any questions that you may have.
All right, Cara, great job. I got a panel here that I'm super, super pumped about. We got my dad, Dr. Tom Rogers, the founder of Performance Medicine, and our medical director. We got Sherry Fetzer, my favorite health coach and host of the Lifegasms podcast.
Yes.
Please subscribe. And Jasmine Allmon, my beautiful, beautiful friend who we just hired literally, how long ago?
Roughly about
A month ago, and then she just got off vacation, and we asked her to come up here and speak. So thank you, Jasmine, for being here. So we have an intimate crowd here. I would really, really encourage you guys to ask questions. What Cara did so well is give an overview on what this type of medicine is. Anti-aging, integrative, however you want to describe it. We describe it as the keynote way. So what we're going to do now is get real specific. So if you have questions, please ask. This is a great time to get any sort of concerns you have, because I know there's things about hormones, there's things about nutrition you're hearing that you want expert opinions on. So please don't hesitate to ask. And I'm going to do the same. So I'm going to start us off here, and I want to start with Sherry. I want to dig a little bit deeper on nutrition and weight loss, and what Cara did was kind of give some of our philosophies. As a health coach, kind of tell us what are some of the big roadblocks you see, because it seems like everyone has the information. What's stopping them from actually getting where they want to go or executing on some of this advice?
Yeah, so that's actually a very complex answer. But the simple answer is that most of the time people overcomplicate it. With nutrition, it's not a matter. I mean, everybody knows to eat right and to eat less and those kinds of things, but it's actually getting too hung up, where they get confused. They get confused about all the different information out there. They overcomplicate it. They try to get very specific about certain things, and then that confused mind just says no and just gives up. So really for me, the most optimal way to approach it is to just keep it simple. Keep it simple. Keep it simple and small. So do small things at a time. Keep your nutrition simple. I always tell people eat as close to the ground as possible, meaning the least amount of processing that your food goes through, the better. And keep it small with the changes that you make. Don't try to come in and just do one big sweeping thing, because it's kind of it creates a backlash when you overcomplicate it. So just make these small steps, and then you actually end up having a compound effect over time. And it's really, truly committing to the consistency too. Keep it simple and just commit to consistency. And then the next thing you know, you completely change the trajectory of everything. Does that make sense?
It totally makes sense. One question I have is where should people start? Because like you said, it's starting one thing at a time when it's so complicated. Where's a good place to start for somebody?
So a good place to start is, it really depends on the person.
Okay.
It really depends on the person. I mean, you have to be realistic about the kind of changes that you're willing to make.
Okay.
It's because long term, it's about the behavioral change. So being realistic about if you know that you cannot do without your ice cream, then figure out something else, and also think in terms of adding in the good stuff versus depriving yourself of something. Does that make sense? So add in the good stuff, add in some healthy things, and then next thing you know, you sort of just weed out the bad stuff.
I feel like it's the same thing with exercise too. If you're trying to build in exercise, start with walking. Start with something that you can build into your life and not be
that you don't need expensive equipment for.
Right, right. You don't have to make a huge change about. So that's really, I love that what you said about the food there. That's really cool. That's really
Just add in the good stuff, and then the bad stuff ultimately will end up taking care of itself, usually. And be realistic. Don't go in and think you're going to just make all these big sweeping changes, because you set yourself up for failure. You want to. And think in terms too, just keep it simple, keep it small, and committing to consistency.
Do you see any relationship between food and hormones?
Oh yeah.
Is there any sort of advice you can give the audience about that?
Well, Okay, artificial sweeteners and processed starches and sugars, they're the equivalent of the devil in my book. And a lot of men don't even realize that sugar converts their testosterone to estrogen. So it increases their estradiol levels. So staying away from processed starches and sugars as much as possible, because it really does have this holistic effect on your entire body. You know, what you're taking in is what you are going to be getting out in terms of your metabolism and so forth. So it really does have a huge effect on everything.
I love that. Just taking out sugars. We did a podcast today.
Yeah, exactly. Just look at the ingredients. If it has sugar in the first 3 ingredients, just don't buy it. If it's not in your grocery cart, it's not in your cupboard.
Yeah, I love that.
Yeah.
I'm going to move to you, Dr. Rogers. Dad. You've seen so many men for hormone replacement. You got into this 12 years ago. What's been the biggest pushback you've received? Like when you're talking to patients about hormone replacement, what's the biggest concern they have?
As far as men go?
As far as men go.
Well, probably there's a lot of misconceptions about testosterone in itself. We've always kind of heard about it through bodybuilders and abuse of testosterone because it is an anabolic steroid. But there's a lot of misconceptions about it. A couple misconceptions I'll clear up for you. Testosterone does not cause prostate cancer. It doesn't hurt your prostate at all. Even if you had prostate cancer, you can still take testosterone. It wouldn't affect it. Now, we don't do that because of medical legal reasons, but testosterone will not cause prostate cancer. As a matter of fact, it prevents prostate cancer. How many young people aged 20 to 30 do you see walking around with prostate cancer? Their T levels are out the roof. None. How many old men do you see with prostate cancer? Almost everybody with low T. So low T is a risk factor for prostate cancer and also enlarged prostate. So that's one misconception. Of course, we follow the prostate. It gives us a good chance to evaluate your prostate because when somebody comes to me for testosterone, of course, I'm going to address everything with them. So the second big misconception is that it causes heart disease. It does not cause heart disease. It prevents heart disease. Your heart is a muscle. And you actually have more receptors for testosterone in your heart than you do your testicles by about 1,000 times. So now when you get testosterone replacement, you have to know what you're doing because it can aromatize or turn into estrogen. And estrogen is good for women, not so good for men. It can also bump up your hematocrit, your red blood cell count, which can cause sludging of your blood and make your blood a little more thick. It's never been shown to cause a stroke or heart attack, but theoretically, you don't want your blood too thick. So probably 5% of people that are replaced with testosterone have to get an estrogen blocker or donate some blood occasionally. It's about 5%. So you have to know what you're doing. There's different forms of testosterone. It just gets a bad name because a lot of the bodybuilders and people that don't know what they're doing are taking animal steroids and everything to make them bigger, but it's a fact that as we age, we lose muscle, we lose bone, we lose brain power. And testosterone is not just for muscle and libido. Of course it helps them, but it's also for your brain, for your bones, for your energy levels. I found out through the years if I ever get a middle-aged guy that comes into me depressed, he doesn't have a Prozac deficiency. There's no such thing. He has a testosterone deficiency about 90% of the time. So a lot of times they've been put on Prozac, which further depletes your hormone levels and cause weight gain and everything else. So, I could go on and on about our medical system, and having been a doctor for 35 years and being a family doctor, so you see a little bit of everything. We're in a bad spot with our medical care. I mean, 2/3 of our country is obese.
I want to ask you a little bit about that because this relates. Cara went through the normal range, and she mentioned that we want people to be in the optimal. And explain a little bit about that. Why you know, you get so many people coming in saying, well, you know, I was told I was normal, you know?
Wish I could draw a graph of a normal bell curve, but the normal range is so huge that it's almost meaningless, to be honest with you. So you have this bell curve, and anything within 96% of people, your doctor's going to tell you you're normal. So the lower 2.5% are going to call you low. Upper 2.5% are going to call you high. Now bear in mind that that bell curve is based on an average population. It's not based on an optimal population. So those numbers like 250 to 700 are meaningless numbers. Oh, she's got the.
We got a board.
All right, I'll draw.
No, this is, of course.
I'll draw the
Yeah, draw that.
bell curve. Well, doesn't even work.
Oh, okay, I can fix that.
That's a terrible. That's a terrible curve. I wish it was some yellow.
The invisible curve.
There we go.
There we go.
Okay. So
You color coded and everything.
it's a bad bell curve, but anyway, it's the way we do things in medicine, really, to tell you if you're normal or abnormal. So 96% of people are in this range here. If you're in the lower 2.5, we call you low. Upper 2.5, we call you high. This bell curve is based on an average population, which in America is a sick, fat population. So it's a really screwed up curve anyway. So you don't even want to use this curve. But every day in my office, because I treat a lot of hormone problems, I mean thousands and thousands of people, but say you're sitting right here on your testosterone level or your thyroid or any of your hormones. Most people are going to say, you fell within normal limits, you're normal. But let your T levels 300, not 299. Yet you have every symptom in the book, they won't treat you, which is absolutely insane. So you listen to patients' symptoms, and symptoms of low testosterone, of course, are being tired, gaining fat, losing muscle, decreased libido, erectile dysfunction, falling asleep after meals, being irritable, grumpy old man syndrome is what I call low T. But you know, there's a myriad of things that happen, and your hormone levels decline as you decline. And this goes for women as much as men. So those normals don't mean a thing, really. You know, you want to kind of measure them, but it's ridiculous that you wouldn't give somebody testosterone here and you give it to them here. You want to be way up here. You know, you'll be optimal. So it goes for women too. You know, I see it every day with especially thyroid. You know, thyroid's a very undertreated disease. Testosterone's a very undertreated disease because it gets a bad name. People think, you know, that's just for bodybuilders, you know, that's for abuser athletes, cheaters. Well, and here's the thing, or it's not natural. Here's my statement to people that say that hormone replacement isn't natural, men and women. You know, nature can be cruel. 100 years ago, the average testosterone level was about twice as high as it is now, and also sperm counts. So those numbers are kind of bogus, really. So you look for symptoms, but it's just very interesting on what's happened. When you say it's not natural to treat this, well, when you get old, it's not natural to wear glasses either. Would you not wear glasses to see better? Would you not wear a hearing aid? If you lose your hearing, as you're going to do as you get age, of course you would. Same thing with testosterone or hormone therapy, whether it be estrogen, progesterone, DHEA. You want to replace it because as you get older and go through menopause or andropause, your hormones decline, and you decline in every way. It's like nature saying to you, you're finished reproducing. Start dying. So if you want to live the second half or third of your life without hormones, it's going to be bad. You're going to get brittle. Your brain's not going to work as good. For women, if you start bioidentical hormones, meaning they come from plants, not pregnant horse urine, that's where the women got thrown off. The doctors and patients got scared of hormone therapy about 12 years ago when the Women's Health Initiative came out. In that study, 8 more women per 10,000 came down with breast cancer. 8 more women per 10,000 came down with heart disease or stroke. That's 8 more per 10,000, and they were using pregnant horse urine, not bioidentical hormones. There's actually much less incidence of those. And anyway, that study, half the women in that were over 65 and smoking. That's what causes cancer. Not bioidentical hormones, they prevent cancer. So and the reason you won't hear this from your doctor is because to get a bioidentical hormone, you have to go to a compounding pharmacy. Pharmaceutical companies can't make bioidentical hormones. They've been off patent for 50 years. So if you want to get one, you have to go to a compounding pharmacy. And us docs we're trained by pharmacies, and it's kind of sad you don't know about it because there's no money to be made by big pharma with hormones. So they poo-poo
They don't
it.
have a rep coming to the office and sending you all kinds of lunch and everything for that. Yeah.
It's rare to see a doctor that knows anything about hormones at all.
Well, I want to ask, because you've presented hormones as almost a safety mechanism, and I want Sherry to chime in on this too. Cara talked about it being a symphony, and as an ignorant person, I'm thinking, well, the danger must be in the symphony. Like if you can't get the symphony right, that's when hormone replacement can be not good. Do you guys agree? Is the danger in being able to manage that symphony?
Yeah, there's so many things you have to look at. Your thyroid, your cortisol, what you want to be is optimal. And as you age, there's a lot of things that go against you. Most people, I'm 65 years old, most people my age don't feel too good. They're tired, they're worn out, they're retired. So it is a symphony. There's a lot of different things you have to think about, like what you're eating. If you're not, like Sherry says, if you're not eating right, nothing's going to work well. So you got to start with what you put in your mouth. And then you look at how much you move, kind of like we have this series that we're talking about every week. And then you talk about stress and how you're sleeping. If you're not sleeping, nothing's going to work that good.
Sleep really is, people underestimate how powerful and how necessary that is for our health.
Is that one of the things that you guys see in terms of people getting on hormones? Sleeping better is one of the...
Absolutely.
Yeah.
Progesterone, women can't sleep because they don't have progesterone as they age. Men can't sleep because they don't have testosterone. They both help you sleep. Plus they help you get energy during the day so you can feel like exercising. But the fourth thing, of course, is hormones. So those are the 4 things we think about with that symphony.
Well, I was just going to say, with the sleep does affect all of your hormones. It affects how, with your cortisol levels, and then that affects everything from there, the way everything cascades down. So, and then even, with the sleep thing too, they did a study with people who slept less but exercised more. They still got, I think, maybe 6 hours of sleep or something like that, but they slept less, they exercised more, and then a group that slept more got more 8 hours of sleep, but they exercised less. The group that slept more actually lost more weight than the group that slept less and exercised more.
I believe it.
Yeah, so it makes a huge difference. Yeah, I know, So,
and we're going to get deeper in that for anyone online.
I know we're kind of touching on next month's subjects, but they all, again, it
that's
goes
part
back
of
to
the symphony.
it all, yeah, exactly. It is a symphony.
I have a lot of guys that come into me. I'm seeing so many young people with low T. It's unbelievable. Late 20s, early 30s. They have low T. Their T level's 200. And these guys haven't abused steroids.
Frankenfoods.
Yeah, foods is the first thing. What are you eating? But I've noticed, I always ask them, where do you work? Everyone, or 80% of them work shift work. And it just kills their testosterone levels, working shift work, which is screwed up sleep
Yeah,
cycles.
it's terrible.
They all have low
Shift work is-
T.
Yeah.
So it's tough.
How do you treat a younger person for hormones, knowing that, because you still want them to produce their own hormones.
You've got to be careful when you treat a person. Number one, when you have a young person with low T, you got to find out why they have low T. Is it primary or secondary hypogonadism? So is it coming from your testicle failure, or is it coming from your brain, your pituitary? So we draw luteinizing hormones, prolactins, and then you got to develop a strategy to keep them producing some of their own testosterone, because if you give them pure testosterone, they're going to shut down any production they have. That's why their testicles shrink up. So there's strategy to it. You use HCG or sometimes Clomid. And in an older person, it really doesn't matter quite as much because they're not going to produce it anyway. But there's certain things you just have to know about this when you get your hormones looked at. And look at your other hormones too. Your cortisol can affect your testosterone or estrogen.
Absolutely, yeah, because you get the whole like pregnenolone steal. When you've got high cortisol levels and your body's just it's taking the pregnenolone to shunt it over to create more cortisol, and then it completely depletes the DHEA, the testosterone, the estradiol,
and guess where, I know what he's going to say. Guess where testosterone comes directly from, or excuse me, guess where testosterone is made from.
Well,
I know you know
that
this, John.
wasn't what I was going to.
Well, hang on one second. It comes from cholesterol.
Yeah.
Cholesterol goes straight into testosterone. So what's happening is we're inappropriately treating people with all these statin drugs to bottom out their cholesterol. They're not going to make any testosterone. And medicines like Lipitor and some of these statins are the most overused medicines in the world because it's billions and billions of dollars. Besides that,
they're worried about the little box and they're not looking at the whole picture.
Besides that, cholesterol does not cause heart disease. That's another subject. But John?
What about aromatase? The enzyme aromatase, it affects men, transferring testosterone to estrogen. Your cortisol levels rise. All kinds of things not good happen. So, do women experience aromatase also?
Sure they do. They have to think about it too.
Okay, so how can we reduce this besides taking inhibitors?
Get lean.
And don't eat sugar.
Get
Stay
lean
away from
because
sugar.
what happens is when you're overweight, you have belly fat, you're going to aromatize your testosterone to estrogen. And women they can have way too much estrogen and not enough progesterone. In women, it's a little more complex. Their hormonal symphony, because men are simple creatures. We have testosterone that slowly goes down. Women have 4 hormones that change, and they cycle with those 4 hormones, and they don't drop off at the same rate. So
We like to keep you guessing.
So yeah, it's tougher for women to figure out their hormones because of one, aromatization and other things that can happen. But so the first thing you do is eat what you eat. I mean, sugar's bad.
It's the devil.
I was at a medical conference in Nashville a few months ago, and a well-known oncologist, cancer doctor, gets out there, and she says 2 things cause cancer. She says sugar and stress. I'll never forget that. Stress causes cancer. There's other things that cause cancer too, like smoking, but obesity certainly causes cancer. Yeah, but so there's a lot of things you need to look at. My idea about medicine is the less prescription medicines you can take, the better off you are. Now, of course, I'm a medical doctor. I use prescription medicines. They save lives, but a lot of times with these chronic illnesses, we're just piling one medicine on top of another that can deplete your hormones, that can cause all kinds of side effects. So, like Hippocrates said, let food be your medicine.
Because I want to get to Jasmine here in a second, but I want to go a little deeper on thyroid because you said it's super undertreated. And I hear a lot of people, my age having thyroid issues. What are some of the signs, and how do you prefer to treat it?
1 out of 4 middle-aged women have a suboptimal thyroid. And
what does that mean, a suboptimal thyroid? Just it's not
that
working?
means there's such a huge range of normal that, and a lot of docs don't look at the right thing. They just look at a TSH or a T4 blood test. You really need to look at a free T3. That's where the money is, like Cara was saying. But you look at the symptoms, and the symptoms of a low thyroid are being tired, gaining weight, thinning hair, brittle nails, constipation, cold hands and feet, brain fog, tendency to retain fluid, and they're probably normal on this thing here, but they're probably right there. And so we prefer to use the combination of T3, T4 products because a lot of people just take Synthroid or levothyroxine, and that's T4. If it's not converting to T3, it's not working. So I try to look at all of it, and probably 80% of women that I treat with thyroid feel a lot better on NP thyroid, nature thyroid, WP, maybe even Armor. So look at the thyroid close. If you're struggling, thyroid disease is so common.
Are those compounds?
Those are prescription medicines,
Okay.
but they're made actually from desiccated pig thyroid.
Interesting.
But I take that 100 times more often than I would prescribe Synthroid, and very few doctors even know about it.
And that's what you're doing for most anyone that has a thyroid issue is putting them on one of those prescription medications?
Yeah, and you check their thyroid antibodies, and you look at trying to find out why they have a suboptimal thyroid, like Hashimoto's thyroiditis is the most common cause that we see for it. And then you have to look at your adrenals, your cortisol. The only hormone that goes up as you age, the rest of them go down. So if you're stressed out, not sleeping, your cortisol's high, it affects your thyroid and also your sugar levels, your insulin levels. So, it gets kind of complex. So
You have to go to the root, it's like you're talking about. You go to the root of it versus just slapping a Band-Aid over, whatever the one issue is. It's like you go to, where is the root of the problem?
Find out why.
Find out
another
exactly.
medicine.
Piling another medicine on, then you have to give them another medicine for the side effects of that medicine, and it's just like this cycle, this medical mill.
That's why the docs just don't have enough time to really figure things out.
Yeah,
Low thyroid, here's your thyroid. What do you think? Why do I have low thyroid?
Yeah.
What can I do to maybe prevent it? It could be in the food you eat, lack of iodine, things like that. So
and like processed foods too can deplete your thyroid.
we can.
Yeah.
All the bromides, the fluorides in your toothpaste, and it all affects your thyroid. So the point is, we live in a very toxic world. And it starts with what you put in your mouth. So that's the first thing and the most controllable thing. So when you're talking about nutrition, the first steps, I agree with Sherry, the first steps is make it simple. Just maybe write down what you're eating. And then figure out why you're eating it. Is it because you're bored or you're tired, you're mad, you're stressed? Why are you eating it?
Another thing you've said in those lines has been your medications. Write down all the medications you're on and why you're on them. And what a lot of people find out is they don't know why they're on them or for how long they were supposed to be on.
Yeah, another medicine, there's a lot of medicines I try to get people off of. Another medicine that's very overused are acid blockers for your stomach, like Prilosec and Nexium and those. God put acid in your stomach for a reason, to help you digest your food and absorb your minerals. And so what happens is somebody goes in with a case of heartburn. They see a doctor, go to the family doc, then they go to their GI guy. You have reflux. Take this Prilosec. They take it the rest of their lives, which is terrible for them. It causes C. diff infections. It can cause worsening of your sugar levels. It's osteoporosis.
Cancer.
So cancer, probably dementia. So find out. You may need these for a week or two, but you don't need them for very long, unless you have a very few rare conditions like a Barrett's esophagus or something. But so medicines are being overused. The doc doesn't have time enough to sit down and try to figure out why. He's write you a script.
Yeah.
See you. I'll see you in 3 months and see how you're doing. We'll look at your numbers again. So you have to almost be your own doctor now.
And that's really why we've titled it Empower You. Is you do have to be your own doc. You have to understand these things yourself. And I love that we use that line a lot, to empowering people to be their own doctor. Jasmine, I want to go to you because when people start to feel better, they also want to look better. And you saw the picture with Dad and Mom up there with the old therapy. Tell us a little bit about how aesthetics fits into this world. You know, how do you see it when you're with patients? What are they wanting?
You want to look good. You want to look good because when you look good, you feel good. And when you feel better, you do better inside and out. So wholehearted. But more than that, I think there's lots of education in how to do that on your own. You don't know what you don't know. And how many, like in your childhood, you would lay out on the beach and laugh at, look at that grin, you see what I mean? And you pay for it later. So if we educate people way before it gets to that, you may not have to invest in certain things if you invest now. So, you know.
I love that, because I know you love to pamper, but the other thing is, like, you're trying to help people prevent things,
Yes.
you know, prevent skin cancer.
Prevention's easier than correction. It's a lot cheaper too. So
how do you protect your skin? You know, give me like the kind of the rundown of how you counsel patients to protect their skin with either some sort of skincare regimen.
Yes,
You know, what's your thing?
now that will vary individual to individual.
Mhm.
Your regimen, but everybody needs to be on something, on more than just the over-the-counter Olay or whatever you get at the drugstore is not cutting it. And I say that because so many people think that investing in medical grade skincare is, you know, a crock.
Yeah.
But there's a reason why it costs more, because it does more. It's more effective than the stuff you can get from the grocery store. You know, the UV rays that is today wasn't as bad as it was back in the day. So maybe your mom could get away with it. But the damage we've done to our planet has made a difference in the results you get in your skin. So
I've never thought about it that way.
absolutely. The toxins in the air that you breathe in, yes, internally, it all plays full circle.
We're constantly interacting with our environment.
Absolutely, and it's insane to think about that it's all connected. Your internal health has a direct effect on your skin and your external. So, and a lot of people don't understand or know that. So, I love to educate and equip and pamper as well. So that's what I'm all about. So a lot of people just don't know what they don't know.
And the other thing is, like, it seems like a lot of us, including myself, will come to people like you to correct things. You know, because say we can't necessarily prevent, might be a little too late. How can you correct through some of the, like, either products or?
Absolutely. That's why I emphasize the medical grade skincare line versus things you get over the counter, because it does help to correct as well as prevent. So absolutely. But like I said, that would definitely vary from individual to individual. I'd have to sit down, figure out your lifestyle, figure out your goals, figure out you know, things that you struggle with to be able to tell you what it is that would benefit you the most.
Super cool. We're so pumped you're here.
Me too.
So guys, we're going to wrap up. Thank you guys so much. We're going to hang out just for a little bit. So if you have any questions to ask the experts, you can. Facebook, Instagram, thank you guys. We'll see y'all next time.